I'm in New York City, which is the epicenter, and I'm not on the front lines, but from friends and colleagues on the front lines, it's been really hard. Hospitals have been overloaded. People have been really sick. It's been a major problem. What I'm seeing in my practice or hearing from in my practice are people who either haven't been that sick. A lot of the people who actually haven't been that sick and who have had it often have had a healthy lifestyle, been taking certain supplements, which is obviously anecdotal, but I'm definitely hearing that. The second pattern I'm seeing is people seem to be, or some people seem to be having this for a long time. They seem to get over the initial infection and then they get reinfected or something secondary happens that can last for a couple, not just usually a week or two. Sometimes it goes on for 3 weeks, even in longer, some people. The other pattern that we're seeing is that generally the healthy people, or what we would call metabolically healthy people, are doing better, and the people who are dying or not doing so well are people who have diabetes, heart disease, obese, chronic illness, but generally what we would call metabolically unhealthy. Those are the patterns we're seeing. And lastly, social distancing definitely works. I mean, New York, we seem to have hit a peak. It seems to be going down. So we need to continue doing that. And as it spreads throughout the country, that's what I would tell you what's happening in what I'm seeing in New York. Yeah, there's no question that it's working. I mean, we can see it in New York, and why social distancing works is if you, I'm obsessed with this viral load concept that the amount of virus you're exposed to, if you social distance, you're not re-exposing yourself to virus all the time. So I think that's part of it. Why it flattens the curve is if you're staying away from lots of people, you're not having a lot of people infected all at the same time, which is what the problem has been in New York or Italy and Spain. It overloads the hospital system. So what the benefits of not flattening the curve, not what I'm suggesting, is the only way we're going to get past this is, or on a country level, is when we have herd immunity or maybe a vaccination. So I think the herd immunity will come about quicker because we've had so many infections, whereas a place like Australia, where they've managed it pretty well, but they're going to have years and years of probably smaller outbreaks and not so much of a problem because the herd immunity will take longer to build up. What happens is, let's say I have the virus and I give it to 5 other people and they develop antibodies to it. And herd immunity means you become immune to it by developing antibodies. And I think a lot of us probably have them or have been exposed and have them just by being exposed to other people. The more people that have the antibodies, the less of a problem it is. And I think the future of how we're going to stop social distancing and get back to life is actually probably measuring antibody levels. I mean, I think probably everyone should have antibody levels checked, and that can determine, what you can do. But we still don't know how effective those antibody levels are, because I just saw something out of Korea that people are getting reactivated. So, but theoretically, once you test someone and they have antibodies, they shouldn't be getting the infection again, theoretically, but all things are off the charts now. So I'm not sure what the story is with coronavirus, but that's the theory. So sorry, I'm going off question here. But I think social distancing definitely works because you're staying in your own, your own little circle. You're not spreading the virus. You're not being exposed to the virus. And with a lower amount of people being infected in a small amount of time, you're not overloading the hospital system, which is what happened in New York and is probably going to happen in more and more places across the states. But Bob, I have a question. What this viral load thing? Why isn't this is why I think these young doctors or doctors working on the front lines, especially without PPE, it's crazy, are getting sick because they're exposed, or the respiratory therapists in particular, they're exposed to such a big dose of the virus that that's if you have, it's like we don't say that with toxins, but the dose is the the poison. What do they say? The dose is the poison. The poison is
the makes the poison. Yeah,
dose makes the poison. Right.
Right. Well, that's probably true for this particular virus. Is that infectious dose? That initial exposure probably explains why so many healthcare providers are getting seriously ill. Which has happened all over the world. It happened in China. So in China, they said, well, it mostly affects old people and healthcare workers. These healthcare workers were younger. Well, they're getting blasted with these aerosols. So the real question is, how much of a virus can you be exposed to without getting sick? And it's going to take a while to figure that out. But if we knew that, that will answer questions like, well, is it safe to go for a walk if you're wearing a bandana? If you're not wearing a surgical mask, you're wearing a bandana, which presumably still gives you some exposure. Is that really going to help? I do want to point out something one of my patients said to me yesterday, which he said, look, Bob, let's just clarify. We're talking about physical distancing, not social distancing. He said, I don't want to give up the social stuff because, I enjoy having my connections with you. And, more and more people are doing exactly what we're doing right now, which is talking by Zoom chats or, telephone, etc. I've even seen some bands do concerts.
Yeah.
And that's amazing, like how they time that so that they're actually playing together. So, in terms of our mental health, like as we physical distance, we need to figure out how to shorten the social distance, but increase the physical distance.
I think that's a really important point. I think a really important aspect of staying healthy is staying connected. And, becoming lonely and depressed and being by yourself or not connected is an issue. So I think it's a great point. It's about physical distancing, not social distance.